Medicaid has about 800,000 people on it. It's a big, big part of our budget, $6 billion. But more importantly, what we do on human services and through the Medicaid program is provide services and protect those that are most vulnerable in our community. And that's something, whether you're on human services or not, you should be aware of, first of all. And secondly, it should be important to you as a policymaker, because we in this building have a lot of responsibility, and we shouldn't take that lightly. And we should also remember at the end of the day, we're only as good as what we do for the people in our community. Next up is Molly Rees Gavin. Molly is somebody that has a lot of expertise in many areas, and Molly has been someone that I met early on in my career here and has always appreciated her honesty, which I love. We may not always agree, but I love the honesty and your passion about what you do. So thank you for being here.
Thank you very much, Representative Abercrombie, and thank you to all of you for being so attentive. Oh, I'm sorry. Thank you to all of you for being so attentive. You're more than halfway through the program now, because I counted how many people have spoken before me and how many are here to come. So you're on the downhill. I really, really appreciate your attention. And as Representative Abercrombie said, my name is Molly Rees Gavin. I'm the president of Connecticut Community Care, a statewide nonprofit, what is known in Connecticut as an access agency. And I'm here today representing not only Connecticut Community Care, but to let you know that whatever district you represent, there is an access agency in your district that does what Connecticut Community Care does in the districts that we serve. So in South Central Connecticut, the New Haven area, we're talking about the Agency on Aging in South Central Connecticut. In the southwestern part of the state, Bridgeport, that area, we're talking about the Southwestern Connecticut Area Agency on Aging. And in Waterbury, the Western Connecticut Area Agency on Aging is the access agency that manages most of these programs. So let me just begin very briefly with a very quick definition, if I might, and this is truly a layperson's definition. This is not a Kate McAvoy exquisite exquisite definition. This is just me trying to tell you what an access agency is and what we mean when we say a waiver. So when we're talking about waivers here in Connecticut and across the country, we're not talking WAV, we're talking WAIVER, and basically a waiver is an opportunity that is granted by the federal government for states to waive, WAIVE, to waive traditional Medicaid requirements in order to be able to offer innovative, creative kinds of services. So the Medicaid package stays in place, but there are waivers in Connecticut and throughout the country that will help us to be innovative and creative and look at different and more cost-effective and higher quality ways to do our work. So that's enough for you in your first day in your new role to know about the waivers. And in Connecticut, we have what are called access agencies. We're one of the access agencies, and basically those are the agencies in the state which the Department of Social Services contracts with to manage the waivers and related programs. Enough about that. Two quick points I want to make to you, and Deb Hoyt already made one of them. The vast majority of people want to stay in their own homes as they age and as they confront greater disability. You all know that. 90+ % of people want to stay in their own home. Number two, the vast majority of care at home is provided by the informal network, by the family. I really want you to know that. Study after study after study demonstrates that about 80% of all care at home is provided by the informal network. So I don't want you to leave here today thinking that the state is paying for or the federal government is paying for services that should be done by the family. Shouldn't the daughter take care of her mom? The vast majority of care is provided by the informal caregivers in Connecticut and throughout the nation. So I really want you to know that. And I want to talk about, very quickly, two specific programs. One Representative Abercrombie mentioned, Money Follows the Person, and the other is the Connecticut Home Care Program. Before I do that, I also want to bust one of the major myths about how we provide services here in Connecticut. And that is to say to you that not every person in Connecticut over the age of 65 is eligible for the services that we're talking about. If your grandma needs somebody to take her to the hairdressers and that's what she needs, we're not doing that. If your uncle needs somebody to take him to the golf course on Tuesdays, we're not doing that. Connecticut has adopted a model that requires that a very comprehensive assessment of any individual who is going to be eligible for home care services, a very comprehensive assessment, must be conducted by qualified people to determine if your loved one is or is not eligible for services through the various state waivers and the various state programs. So the person has to be, of course, you know, I don't mean this to be disrespectful, you know, 1 foot on the banana peel and 1 foot in the nursing home door. These are not individuals who are simply looking for a little help in cleaning their patio, number one. Number two, there are very, very stringent income and asset requirements, as well as the functional disabilities. So those are the 20,000 people who are served every single day through these Connecticut home care program models, and they represent a tiny percentage of the people over the age of 65 in our state. Quickly, Money Follows the Person. In the last several years, 5,500 people have returned to the community because they wanted to be in the community, and they left a skilled nursing facility setting to go home. Please understand that we are in total support of the concept that Connecticut needs the finest nursing homes available in this country, and that we are strongly in support of our colleagues. We work very closely with our skilled nursing facilities. So none of this is meant to say we don't need good nursing homes in Connecticut. We need the best. We need people to be able to be where they want to be. And if that can be in the community, that is more cost effective for people, and it is where people, generally speaking, want to be. So that's our Money Follows the Person model. Gets people in nursing homes, raise their hand and say, I want to try to leave the nursing home, and then a whole team of people on the state level, on our level, from the community providers, we work together to get that person back into the community where they want to be. Lots of challenges, takes a long time, not easy work. Very valuable, and we see through the quality of life studies that we do with those individuals that the consumer identifies a 20% increase in the quality of their life as a result of being able to go back to the community. So think about that. And then finally, I just want to talk about the Connecticut Home Care Program for Elders. That's the biggest waiver that the state manages right now. We have about 20,000 people on any day of the week who are at home thanks to the Connecticut Home Care Program. The care plan costs vary based on the level of the program, but we can tell you that for people on the state-funded program, the average cost is less than the state-funded program is less than $862 a month. And for the federal portion of the program, the Medicaid portion, that cost goes up to a little over $2,000 a month. Yes, every naysayer is going to be able to tell you that they know somebody whose care plan costs exponentially more than a nursing home costs. They're probably not on one of these waiver programs, would be my bet. And of course, there are outliers. I'm talking about that on average, we are saving the state $360 million by the diversion of individuals from skilled nursing to the community, and by helping people to stay at home longer. Enough said. If I had a magic wand, if I had the opportunity to help to set your agenda, 4 quick points that I want to make. We desperately need workforce development. Workforce development at every level of the long-term care continuum is a problem. Number 2, we desperately need caregiver support. Informal caregivers need education, support, they need respite. They're the backbone of the system. We need that. Number 3, we need to focus on quality. And last, we need to recognize that without sufficient reimbursement, this is the emperor's new clothes. The system can't continue. So I thank you very much for your time, and I would also say that if any of you, whatever district you're in, are interested in going out on a visit to meet one of our clients, Of course, that is done only with the client's permission, and if the client wants that. And you'd frankly be surprised at how many older adults would love to have you come and see how they're doing at home. So if that's something that's of interest to you, we will handle it respectfully, appropriately, of course. Just get in touch with us and we'll set it up for you, okay? Thank you so much. And now you're really heading down the hill because I'm done.
Thank you so much, Molly. We always appreciate you being here.